All right. So, quick agenda of what we are going to cover tonight. We are going to talk about who we are. And on the call with us tonight, myself, Liam Newcomer, I work with the marketing team and the membership enrollment team to help get new patients like yourselves in the door and existing patients more of our services that they can enjoy. Patrick Ham is also on the call. He's our business manager. Christine Gill as well with our membership team. Dr. Williams, our founder, has joined us as well tonight. So you have a litany of people to be able to answer any questions that you might have and provide insights further on the program itself. Last but certainly not least, we also have Dr. Brad Moore with us, who's going to spend a little bit of time talking about lifestyle medicine and lifestyle medicine as primary care. Dr. Moore is uniquely positioned in this area as one of the only doctors duly board certified in both internal medicine and lifestyle medicine. So he's got a lot of really, really good things to say when it comes to longevity and your health. I know he won't say it himself, and I'm going to give him some time to introduce himself a little bit later on, but I know he won't say it himself. He's a 10-time repeat top doc listed in the Washingtonian. So I wanted to make sure that he got his accolades. He's a fantastic guy, a wonderful speaker, and I'm really excited to hear about what he has to say tonight. Once he wraps up his section, we will talk about next steps and what we can do to get involved with complete concierge care, and then of course address the questions that you have. So with that said, who we are 10 doctors between 2 offices here at Complete Concierge Care. We're a concierge primary care practice. We believe that medicine depends on great communication with our patients and the specialists we refer them to, as well as the families who participate in their care. So, we believe a lot in accountability and communication with our patients to form that bond and a lot of trust between all of our patients. So we strive to excel at the little things, right? To make great healthcare. Doesn't stop just with the doctor. It's in everyone's job description. So everyone that you speak with here is trained and able to help as much as they can. You'll notice that some of our doctors listed here are full and no longer taking patients. That said, Dr. Moore on the call with us today is, and several of our other doctors are as well. The other panels are beginning to fill fast. So speaking of our 2 offices, we've got 2 locations, one located in the Sibley Memorial Hospital. That's actually where myself and Dr. Moore are today taking this call from. We are also located in the Camelier building on Fernwood Road in Bethesda, Maryland. So when we talk about our practices and really what our core beliefs are, it is distilled down to 3 main pillars: access, convenience, and care. That's what we stand for, complete concierge care. That's what we believe in, and that's what we want all our patients to feel. When we talk about access, we answer the phone when you call. We often hear from our new patients who are just coming on board what a relief it is that our phones connect directly to staff, so they can always speak with someone familiar with their care. 24/7 access to your physician via their cell phone and their email address. So if you have an emergency or any reason that you need to speak with your doctor and off hours, you will be able to. That's part of the communication and accessibility that we really believe in at Complete Concierge Care. Same day or next day sick visits. So we do reserve space on each of our doctors' calendars to ensure that you can get in same day if you have an emergent sickness or next day. If you need to speak with someone urgently, we will reserve the time and ensure that you are able to see your doctor. Convenience is another huge piece of what we do here. So each of our patients have access to MyChart through Johns Hopkins. So you can view all the results of your appointments instantly. We do our blood draws, vaccines, injections, immunizations, EKGs, all lab work and all viral testing is performed right in office, so that you have easy access and quick access to the things that you need. Like you saw on that initial slide, our patient panels fill up. So our doctors only see a limited number, which is significantly lower than what you would typically see in primary care, which means that they are available for you. They each have a smaller number of concierge patients, ensuring that they have the time, the energy, and the space to make sure that you are getting everything that you need out of your doctor. The last piece is care. We have extended appointment times for each one of our patients. It's typically 60-minute physicals, 90 if necessary. So you know that you have the time to ask all the questions of your doctor to get the in-depth briefing that you may need in each one of your visits. Our doctors have privileges at Sibley Hospital and Suburban Hospital, so you can be visited in the hospital if it ever were needed. You can have people come right down to you and speak with the physicians that are attending to you there as well. Our doctors make referrals really easy. They have great networks of doctors in the area and other specialists. So if you have needs beyond the scope of what your primary care doctor might have, they will be able to help you coordinate that and put that all together for you to really make that process a lot easier. So that's a little bit about Complete Concierge Care, who we are and what we do. Again, I want to reiterate the fact that if you have questions about our practice, feel free to put them in the Q&A. Make sure that you are able to have those questions answered. You also always are more than welcome to give us a call, get on our website, book some time with one of our doctors. If there's ever anything further that you wanted to talk about, they are open and willing to talk with you. Before I hand it off to Dr. Moore to talk a little bit more about lifestyle medicine, I wanted to kick it over. Dr. Williams, is there anything that you wanted to add to my presentation here, and anything more that you wanted to say?
Sorry about that. I was trying to turn off my mute. Thank you, Liam. Thank you, everyone, for taking the time to be here. What do I want to say? I want to say if you're looking for a practice, please be sure to take a look, not just at the doctors you meet, but the other employees you'll work with when you come in to visit us. We're very proud of how hard all of our team works. And the one thing I would add to our philosophy, as Liam described it, was that every employee, every visit is there to make you the priority. And I think that is what sets us apart, and it's very important to us. And we hope you'll consider us for your care and consider Dr. Moore for all he can add to the way you work with one of our doctors. That's my speech.
Thank you. Appreciate it. Awesome. So with that, we have got a little bit of lifestyle medicine that Dr. Moore is going to jump into. Dr. Moore, I kick it over to you. Feel free to take control here and introduce yourself a little bit and educate the people on what it is that you do and how you can help.
Okay. Well, do you guys see the right screen? Can you hear me?
Yes, I see your screen.
Yep,
Okay.
I hear you. All good.
Great. Well, thank you so much. It's great to have all of you here, and I love talking about lifestyle medicine. Before I jump into that, I want to just tell you a little about myself. For the past 30 years, I've been practicing primary care internal medicine at George Washington University. About 10 years ago, I learned about lifestyle medicine and became board certified in 2019, and it fundamentally changed the way I practice medicine. I practice what I call lifestyle first primary care. That really made a difference in my patients' lives, and for that reason, I wanted to make it part of the training of residents at GW. So I started a lifestyle medicine pathway within our internal medicine residency program, where residents training in internal medicine can be board certified in lifestyle medicine as well as internal medicine when they finish training. I'm going to talk to you about lifestyle medicine tonight, but I really think it shouldn't be a specialty. It should just be the way medicine is practiced, and that's what I'm hoping the next generation will pick up. So with that background, I wanted to just share with you what I've learned after more than 30 years of practicing internal medicine at the George Washington University. And during that time, I've become convinced of one thing. The most powerful treatments we have are not prescriptions, they're behaviors. Tonight, I want to show you what lifestyle medicine is, why it matters now more than ever, and what you can begin doing immediately to improve your health span. So the average American lives 76 to 79 years, but they spend the 10 to 15 of those years with chronic disease or disability. 60% of adults have at least one chronic disease, 40% have two or more. Medicine has learned to extend lifespan, but we've not extended health span at the same time. If you look at this table, the solid line in this chart is an expected life without any medical intervention. And when your quality of life or your health span gets below 50%, that's when you start feeling your body every day. You know, the goal is that you shouldn't be thinking about your healthcare every day. And what has happened with traditional medicine, and that's this small dotted line that's close to the solid white line, is that people have seen their health span decrease at the same rate, but then at the end of life, because of the technology that we've been able to extend lifespan. That's this little blip here at the bottom, that sort of foot on the curve. What lifestyle medicine promises is this large dashed curve, which is an extension of health span. Some people refer to it as medicine 3.0. The idea is that you stay healthy as long as possible. One of my mentors used to say, the goal is to die young as late as possible. So the good news is that most of the chronic diseases that we talk about that limit independence, heart disease, diabetes, stroke, dementia, they're not random. They accumulate slowly over decades. The good news is they're also largely modifiable. So what is lifestyle medicine? Well, there are 6 pillars of lifestyle medicine. And they are a whole food, plant predominant diet, regular physical activity, restorative sleep, managing stress, avoiding excessive risky substances, and having healthy social connections and healthy relationships. Lifestyle medicine is not alternative medicine. It's not supplement-based medicine. It's not biohacking. It's the systematic application of what the strongest human outcome data tells us, that behaviors and lifestyle choices matter. So I want to go through a number of these pillars and share with you a little bit what we know. And if you look at the leading cause of chronic disease in the United States, you look at this table, what's surprising is it's not tobacco, it's not alcohol and drug abuse, it's not overweight, it's not malnutrition, high blood pressure. It is, number one is dietary risks, really overnutrition. And the most important dietary risks in the United States are diets that are low in fruits and vegetables, low in nuts and seeds, high in sodium, high in processed meats, and high in unhealthy fats. This is one of my favorite quotes. Every meal is a short-term investment in how you feel and perform, a mid-term investment in how you look, and a long-term investment in your freedom from disease. Unfortunately, ultra-processed foods now make up around 60% of the calories in the average American diet. And diet quality is associated, poor diet quality is associated with a 20% increase in mortality, and good diet quality is associated with a 20% reduction in all-cause mortality. High fiber intake alone is associated with 22 to 31% lower mortality. So replacing just 5% of calories from animal protein with plant protein also further reduces mortality risk by 10 to 15%. We can debate diets endlessly, and there's tons of diets out there on the internet. But what's not debated in the literature is this: higher intake of minimally processed, fiber-rich, plant-forward foods consistently predicts lower mortality. Fiber isn't glamorous, but populations with the highest fiber intake live the longest. The average American consumes about 15 grams of fiber per day. Optimal is 30 to 45 grams of fiber today. And that gap alone explains an enormous amount of disease. So I want to talk about physical activity. Physical inactivity carries a mortality risk that's comparable to smoking. Cardiorespiratory fitness, measured by VO2 max, among other methods, is one of the strongest predictors of survival. Adults who lose 8% of muscle mass per decade, and adults lose 8% of muscle mass per decade if they're not resistance training. And grip strength is a tool that we can use to see if you're at risk for that decreased muscle mass, and it predicts mortality. So muscle is not just a cosmetic tissue, it's metabolic currency. Loss of muscle or sarcopenia predicts frailty, insulin resistance, falls, and cognitive decline. And even with that information, fewer than 25% of adults perform resistance training twice per week. If you did nothing else but strength train twice per week, walk daily, your long-term risk profile changes dramatically. Another one of my favorite quotes is this one, that the current human genome requires and expects us to be highly physically active for normal functioning. You know, for most of humans' time on the planet, which is hundreds of thousands of years, we had to travel over great distances in environments where food was scarce. We had to exercise. We had to really fight to get our food. Our body expects us to be physically active. The Industrial Revolution and the technology that's come since then has really only come around in the last couple of hundred years, and our genome has not changed in that couple hundred years. So exercise is really important. A few words about sleep, which I think of as the foundation of good health. Sleeping less than 6 hours a night increases risk of obesity by 55%, type 2 diabetes by 28%. Sleep deprivation increases the risk of dementia and cardiovascular disease. Sleep isn't passive, it's metabolic regulation. We would never prescribe a medicine that increases diabetes risk by 30%, yet many of us voluntarily sleep only 5 or 6 hours a night. Sleep is a performance enhancer for every other pillar. Humans are biologically wired for connection. Isolation is inflammatory, connection is protective. One of the strongest predictors of longevity in global populations, and we know this from the blue zones, is not just diet and exercise, it's belonging. Loneliness carries a mortality risk comparable to smoking 15 cigarettes a day, whereas social connection is associated with a 50% increase in survival. And stress elevates inflammation and is linked to cardiovascular disease. So each one of these pillars is important by itself, but these healthy behaviors compound. If you do these 4 things, have a healthy body weight, have regular physical activity, avoid tobacco, and improve your diet with whole grains, fruits, and vegetables, you can avoid 80% of all heart disease, 90% of all diabetes, and add up to 10 additional years of life expectancy. None of these behaviors works in isolation. They're multiplicative and additive. Small changes, small consistent changes over years produce extraordinary outcomes. So that's the big picture from 10,000 feet, but I want to bring this down to the story of an actual individual patient. I want to tell you about one of my patients, a patient who did get better. This patient was a 30-year-old man. He came to me in January of the year that I met him. He had high cholesterol, anxiety, high blood pressure, obesity, and he was just newly diagnosed with diabetes. He complained of feeling lethargic, irritable. He didn't sleep well. He woke up sweating. And at the first visit, he actually said that he sort of ate a standard diet. And he said, "I'll die before I stop eating meat." And I talked to him. I said, you are at a decision point. You've just been diagnosed with diabetes, and you're at a crossroads, and you need to decide which path to go down. The traditional path that I've practiced most of my life involves giving you some medicine for the diabetes. What usually happens is that after a couple of years, you need more medicine, and sometimes we need to give you medicine to treat the side effects of our medicine. The advantage of that path is that the only behavior change that you need to make is that you need to take your medicine. The disadvantage of that path is that you're going to be on medicine for the rest of your life, and you're probably going to need more and more medicine. The other path involves learning what the root cause of type 2 diabetes is and treating that with lifestyle. The good news is you probably won't need medicine. The harder news is you're going to have to make big changes to the way you're eating, the way you're moving, the way you're sleeping. But the advantage of this long term is that you're likely to not need medication, or if you do need medicine, you're likely to need much less. And you're also decreasing your risk at the same time of heart disease and chronic kidney disease and dementia and cancer. So which of these sounds like the path that you want to go down? And he chose the path of lifestyle change. So what we implemented at the beginning, our initial prescription was a whole food, plant predominant diet, movement, walking 10 to 15 minutes after meals initially, and then increasing that, increasing non-exercise physical activity, eventually trying to get up to 150 minutes a week. For resilience, exercise for stress management, and sleeping 7 to 9 hours a night. And we wanted to bring in the support of his family and friends to support this lifestyle change. So I want to show you what happened. This shows the medicines he was on. He was taking atorvastatin for cholesterol, lorazepam for anxiety. He was on lisinopril and hydrochlorothiazide for high blood pressure. This didn't happen all at once, but after 6 months, we were able to decrease his cholesterol medicine from 40 milligrams to 10. And as I'll show you, his cholesterol actually got better on less medicine. He didn't need the anxiety medicine anymore. His blood pressure medicine stayed the same, but his blood pressure values improved dramatically. He did lose a little bit of weight. His blood pressure went from elevated to optimal. The hemoglobin A1C is a measure of what your average blood sugar is over a 3-month period. Diabetes starts at 6.5, and he was 12.7 at the beginning. After 6 months of following this plan, his A1C came down to 5.5. That's not diabetes, that's not pre-diabetes, that's normal. And he did that without any medication and with pretty modest weight loss. His cholesterol on 30 milligrams less of cholesterol medicine dropped dramatically. His LDL went from a risky level of 112 on a high dose of medicine to an optimal level of 53 on a low dose. And he'd had some problems with liver inflammation, and that got better as well. So overall, he lost 16 pounds. His blood pressure decreased. His type 2 diabetes went into remission. His liver inflammation improved. He had heartburn, that resolved. His anxiety improved. His sleep increased, and his energy level improved. So on all of the markers, he got better. But what means the most is how he felt. He told me he had more time to be active with his kids. He was more engaged with his wife. He was less irritable. And he said, I feel like I'm living more. So that's just one illustration of the kind of changes that are possible with lifestyle-focused care and proper support. And the good news is it's never too late to change your trajectory. Many people assume that by the time they reach their 50s, 60s, or 70s, the trajectory is already set. But the data tells a different story. In large prospective cohorts, people who adopt healthy behaviors, even in midlife, gain meaningful years of life, and more importantly, years free of disability. Fitness improvements at virtually any age reduce mortality risk, and I have personally seen patients in their 60s and 70s reverse prediabetes, improve blood pressure, reduce medication, regain energy, rebuild strength. The body remains remarkably adaptable, and small sustained changes compound over time. The earlier you begin, the greater the return. Your trajectory isn't fixed. So taking charge of your health, what can you all on this call do tomorrow that would make a meaningful difference? Well, you can start strength training, and that doesn't need to be at a gym. It can just be with body weight. Goal is twice a week. Walk 10 minutes after dinner. Increase fiber in your diet from whole foods. That's going to mean eating more plant foods. There's no fiber in animal foods. And prioritize getting 6 to 8 hours of sleep. So my philosophy of care is that in order to make meaningful lifestyle change, patients need 3 things. They need the knowledge of what their personal risk is and what of the lifestyle pillars would make a difference for them. They need to find their motivation and internal alignment to have the right attitude. And then they also need the practical skill of knowing how to execute this change over time, how to make these changes, which are probably different than what you've been doing most of your life, how to make that work in the rest of your life. Information alone doesn't change behavior, but structure and accountability do, and that's what we provide. Traditional visits fall short because they're short, they're 10 to 15 minutes. They tend to be medication focused. They tend to be reactive rather than proactive, waiting for a problem to happen and then trying to find the right Band-Aid. I practiced in that system for decades. It's good for acute care, but it's not really designed for chronic disease and behavior transformation. I really think that the optimal role of lifestyle and care is at the foundation. If I'm your primary care doctor and you come in with a problem, I'm going to look for the lifestyle factor that may be causing the problem and the lifestyle adjustment that may improve the problem. All the other resources of medicine, standard medical care, drugs, procedures, all of the technology, they're still on the table. But we should start with lifestyle first, because the benefits of changing lifestyle outweigh the benefits of finding the right high technology Band-Aid to put on the problem. So I'm going to pass it back to Liam to talk a little bit more about the details of joining the practice And then I'd be happy to take your questions about lifestyle medicine. Liam, I'm going to stop sharing, I think. There we go.
Much appreciated, Dr. Moore. Thank you for that. And we do already have some fantastic questions in the chat that you can take a look at right now. We will get to those momentarily. Very excited to hear about your answers to those because I'm actually a little curious myself. But before we get too far into that, let's talk about next steps and what we can do to get you in front of Dr. Moore and get you a part of this practice. So we have our lifestyle first primary care model, where you will get the full concierge primary care experience, lifestyle medicine consultation integration, and 24 access to Dr. Moore. You will get the telehealth and in-person appointment options depending on what fits you and your lifestyle. You know, we always prefer the in-person. We think that it's a little bit more intimate, a little bit more connected to your doctor. And we hope that you agree once you get into the swing of things here. We are in network with Medicare and most commercial insurance plans. I saw that question pop up. Most people have that question, so I'm happy to answer that for you now. And we can dive deeper into that if you want to give us a call either tomorrow or schedule an appointment with us. You know, insurance is obviously can be complicated. It's much healthier and easier to work it out with us. If you are already a member of Complete Concierge Care, or you are really fond of your current primary care, we do also have a consultative approach to this, where you can bring on Dr. Moore as more of a consultant role. That would be a $2,500 annual membership fee rather than the $5,000 fee, and he would not be your primary care doctor. You would still remain with your own primary care doctor. But you would still get all the benefits of working with Dr. Moore and his lifestyle, his lifestyle medicine. You get the full lifestyle medicine assessment, care based on your goals, and regular follow-up. So if that is an option that fits your life better, you are more than welcome to it. So next steps, what does this look like? Next thing we would do is schedule a free meet and greet. Everybody tonight, we would be more than happy to have you with a quick, 30-minute, no obligation, free consultation with Dr. Moore. Talk to him, ask him the questions that you have, get a better understanding, help him understand your medical needs and what the path forward may look like. And then after that, we get a membership agreement to you. You pay your fee and we schedule our initial consultation, which will be a 90-minute deep dive into you and your health and the needs that you have upcoming. And then hopefully from there, Dr. Moore would be your primary care provider and be able to help increase your health span. So what that looks like in practicality, if we visit our website right here, you are welcome to use that QR code. You can give us a call at 202-951-9211. That'll be directly to our membership team. Call them tomorrow starting at 8 a.m. Our office is closed at the moment, but you will get anyone from our membership team if you start calling as of tomorrow. Lastly, you can scan that QR code right there, shoot our membership team an email with your interest, and we will get you scheduled for your free, no obligation consultation with Dr. Moore as early as next week. So really excited and eager to engage with everyone on this call a little bit further, hoping that we hear from you and hoping that we can get you scheduled and continue to help with your healthcare. So with that, we will move into questions. I kind of want to break it up into two pieces here. So number one, Dr. Moore, I know you've got a couple questions already targeted you in the Q&A. Hopefully we can kind of start with some of the healthcare-based questions. And then as questions continue to arise more generally about the practice, we can take that on the administrative side. So let's start with Dr. Moore. I'll hand it back to you.
Okay, well, I'll read the first question here. Can you define and give examples of highly processed foods? Well, let me just talk about processing foods in general. Changing the shape mechanically of a food, taking whole oats and flattening them into rolled oats is processing, but that's not the bad kind of processing we're talking about. There are different definitions of what makes a highly processed food or an ultra processed food that has to do with how they're treated, what's added, and what the purpose of the additives are. I think from a health standpoint, the most helpful definition is you want to think about what is an unprocessed food. And an unprocessed food is a food that has had nothing bad added and nothing good taken away. So, for example, brown rice still has all of the fiber that is in the rice. White rice is processed in an unhealthy way because the healthy fiber has been taken away. When you look at a lot of foods that are sort of what we traditionally consider junk foods, and you look at food labels and you see, more than 5 or 6 ingredients, many of whom are chemical names, not things that you could go out and find in nature. Those are examples of unhealthy processed foods. But again, shoot for the healthy foods, foods that have nothing bad added and nothing good taken away. Second question, what is the position of the practice on prescribing off-label for evidence-supported anti-aging benefits? For example, GLP-1 drugs, SGLT2s, rapamycin. So, our longevity practice is really focused on improving health span. The idea of adding quality years of life rather than adding just numerical years. So adding life to years rather than just years to life. We really focus on those pillars of lifestyle medicine when it comes to supplements or other things. They are really of marginal benefit. Getting the basics right really provides much more benefit than a lot of supplements. When it comes to supplements, we evaluate them based on whether or not they have good evidence in human data. A lot of supplements, their claims are based on data in mice or yeast. We look at whether or not it's something that's practical for patients to do from an economic and a really functional standpoint. And then we look at what's the evidence that these are safe in the long term. And for us to recommend them, they have to pass those 3 tests. And most of the off-label uses don't actually pass those 3 tests. We are watching some that are promising, but as I said, they have to pass those 3 tests. Our entire practice is very evidence-based. We are very evidence and data-driven, and that's how we make those decisions. Next one I'll take is, do all the primary care doctors listed on the first or second slide practice lifestyle medicine, or do they report to Dr. Moore? Well, they do not report to Dr. Moore, but they don't practice lifestyle medicine. I was brought into the practice to start this new lifestyle medicine service line. I support many of their patients in a consultative role where they keep their primary care doctor in the practice, and I provide lifestyle medicine support to them, working with their primary care doctors. I can also do that for primary care doctors that are located outside of the practice. New question. What's the benefit of 20 minutes of exercise after a meal to 20 minutes, say in the mid-afternoon? So the most obvious answer to that is if you're worried about your blood sugar balance. After a meal, your blood sugar goes up. Your blood takes the sugar to the muscle. Insulin comes along, moves the sugar into the muscle. And that muscle is able to accommodate more insulin when it's moving. So if you have a meal and walk for 20 minutes after the meal, that's going to do more to lower your blood sugar spike than that same 20-minute walk another time during the day.
Brad, could I jump in and ask, um, do you recommend, or do you have patients who use now the continuous glucose monitors for monitoring that type of? Isn't that what that's for? Or maybe you could explain how those are
Oh
used and
yeah, I
why.
mean those continuous glucose monitors, you know, they are very, very helpful in patients that have diabetes, especially type 1 diabetes. Um, it is controversial whether they really have a meaningful change in outcomes or effect in outcomes in patients with type 2 diabetes. And it's pretty clear that they haven't been shown in good studies to change outcomes in people who don't have diabetes. So they can be interesting, and they're interesting things that we can talk about, but it's not something that we recommend our patients get.
Cool. Thank you.
I already have a PCP affiliated with Johns Hopkins. How can I have a lifestyle medicine guidance from Dr. Moore without changing my PCP? So just call the number, tell them that you're interested in a lifestyle medicine consultation. You don't need to do a meet and greet with me for that. Once you have joined the practice in that way, we will reach out to you and talk about some testing that we would do prior to the first visit, as well as gathering some information about history prior to the first visit, so that when you come to that visit, we can spend less time gathering information, but can really go through the data about what's going on in your health, what your risks are, and begin to set up a plan that we would then meet with you quarterly to support you making healthy lifestyle changes. And I don't see any more open questions right now.
All right. Give maybe another minute, see if anyone's got some last second questions they'd like to ask Dr. Moore or anybody else out here, Dr. Williams or myself or anyone else on our team regarding either the practice or whatever might be on your mind. Feel free to put it into the chat.
Is a glass of wine a week helpful or harmful? You know, the data is pretty clear that alcohol is not a health food. So from a pure biological standpoint, I can't say that it's helpful. The risk that goes up with any alcohol intake, there's definitely a cancer risk that goes up. That said, you know, there are social and connection and stress management benefits from having a glass of wine or something from time to time. And so I would say a glass of wine a week is not really harmful. So that's how I'd answer that.
And I'll ask you a question, Brad. Do you require everyone to do a vegan diet or a vegetarian diet? How do you approach
Absolutely
that?
not. I mean, there is good data that it's really important to have a wide variety of plants in your diet for optimal health. And so, you know, we will talk about those benefits, but we always meet people where they are, and we support them in making the changes that they want to make after they understand the benefits.
I think that's important, and to have everyone here that, you know, it's about meeting people where they are and helping them make progress. And it's the consistent changes that lead to the largest benefit. Liam, I'm going to jump in and just answer a few of the questions that we answered more on the admin side or logistical side. And we talked about insurance for a minute. there's a membership fee, and then on insurance, any face-to-face visit you have with one of our doctors gets billed to your insurance. We file that claim, and after they've paid their portion, if there is a copay or deductible, you would be responsible for those amounts as determined by your insurance. And we kind of spoke about the two different care models, the lifestyle first primary care and the lifestyle medicine consult program, where Dr. Moore acts more like a specialist. And I thought there was one more that I wanted to get to. I think that kind of covers it.
I think you might want to add that we're in network for all insurances except United Healthcare.
Right. Yes. In network with Medicare and all commercial insurances except United Healthcare. That was their choice, not ours. They kicked us out of their network. But Care First, Blue Cross Blue Shield, Aetna, Cigna, Humana. We are participating providers, TRICARE, all the Johns Hopkins plans, including their Medicare Advantage plan. And by the way, for those with United Healthcare, we still see a lot of United Healthcare patients. We file claims on your behalf. Everything kind of works the same way. It just will go against your out-of-network benefits. So not a barrier for us. We definitely have a lot of United Healthcare patients. I will call out too, many folks have Medicare and then a supplemental plan through United Healthcare, to the United Healthcare AARP supplemental plan. We are in network with that because that follows Medicare guidelines. I know it's a very common plan, so I just want to call that out. They would still cover copays and deductibles just like all, in network. The pro, and again, the meet and greet is, if you are curious at all, please contact us to schedule a meet and greet. Come in and meet with Dr. Moore, see our space, see our staff, and another part of our culture is to make sure it's the right fit for you. We want you to find the doctor that's right for you, and that meet and greet's an important thing to hopefully make that happen.
Yeah, it's a great point. And obviously this isn't maybe the best forum for you to be asking the deeper rooted medical questions that you have. So I really encourage you to tomorrow pick up the phone and give us a call. You're going to get another human on the end. You're going to get a professional who cares and wants to take care of you. So give us a call tomorrow. I will put the screen back up with everything that you may need to get in contact with us. I put my personal email address in the chat. I believe that you all can see it. And poke around our website, take a look, give us a call tomorrow, shoot us an email. We really would love to see you. I know that Dr. Moore would love to have a 30-minute conversation, see if this fits, see if this is something that may benefit you.
Yeah, I look forward to connecting with many of you and sharing what I've learned and what I've seen, how lifestyle medicine can really change lives.
Fantastic. Well, thank you all again. Unless anyone else on the call has any last words they'd like to input, thank you all again for your time. Sincerely, it's I know it's a lot to give on a weeknight like this. So thank you very much for spending your time with us, and we hope to see you soon.